drug abuse, cancer,
measles, diabetes, AIDS, cancer.
Good evening once again, folks, and welcome to Doctor on Call, our live program for this evening. And this evening with us, we have Dr. Nerissa Baptiste. Just to tell you a little bit about her, she earned her medical degree at St. George's University and completed internship and residency at Drexel University College of Medicine. She specializes in family medicine and she presently practices at Bradford Regional Medical Center in Pennsylvania. We welcome Dr. Baptiste. Dr. Baptiste, good evening and welcome to Doctor on Call. It's your first time and it won't be a last.
Good night, Godfrey. Thanks for having me.
Yes, indeed. It's a pleasure. I want to talk this evening with you about family medicine. We've heard the phrase, we've heard about family practitioner, we've heard about the family doctor and family medicine. Let's talk a bit about that. When we speak of family medicine, exactly what are we talking about?
So I think the most common misconception is that a family medicine doctor is the same as a general practitioner, which could be easily misinterpreted, but a family medicine doctor is actually specialized. The specialty is family medicine, and what we do that's different from the other specialties is that we see a wider range of patients. So in a family medicine residency, you'd be seeing children, adults. We also do some OB care, so some obstetrics, and we do a little bit of emergency medicine as well.
So basically, you train in almost every area of medicine.
Yeah, so unlike a general practitioner, which usually after a 1-year internship, you'd be not to say, general medicine, a family medicine, you need at least 3 years residency to say you have sufficient knowledge in each category.
All right. But when we hear, because I want to understand this, sometimes we hear a lot about a doctor is a specialist in, let's say, dealing with the heart or the kidneys or different areas of different specific areas of the body.
So for us, that would actually be a subspecialty. So you specialize initially, you would choose family medicine, emergency medicine, internal medicine. Internal medicine deals mostly with only adults. And then after that initial residency, which can range 3 to 5 years for some, then you would go on to study for additional 1+ years, and that's called a fellowship. And that would be a subspecialty. And then you can say, you're a heart doctor or cardiologist. So it's just extra training, but the initial training is a specialty and the extra one is a subspecialty.
All right. Okay. Wonderful. All right. We also hear about primary care. Is there a difference between family medicine and primary care? And if there is, what's the difference?
Well, I think you tend to see mostly family medicine doctors doing primary care. So primary care would be preventative care. So anything that we can do to try preventing medicine from coming on. And family medicine, most of us, I in particular, are really, big into prevention. But pediatricians who only see children will also be dealing with primary care. Actually, OBGYNs also are considered primary care doctors as well because they do preventative care. And internal medicine doctors who only see adults would also do primary care.
Okay, so what sort of procedures do family medicine doctors do? What are they involved in? Are they involved in surgery or
So family medicine can be broad. So for example, in my field, I would start with things small, like I would do like biopsies. If I was worried something might be cancerous, I could do a skin biopsy. But then it can vary to things like doing even minor surgeries. Some family medicine doctors do small surgeries, C-sections. You can do C-sections as well. there's so many. It can range from something very small to people are more surgical. It depends on how you want to find your niche in the specialty.
Okay, wonderful, wonderful indeed. Now, family medicine and internal medicine, you mentioned that earlier. You mentioned about internal having to do with adults and family medicine across the board. Can you speak a little bit more on that?
Yeah, so internal medicine and family medicine tends to cross in some aspects, and you see doctors specialize in internal medicine, sometimes, as I said, just doing primary care. The difference mainly is in the training. So in internal medicine, they only see adults, whereas in family medicine, you'd also see children, and then you'd also see like pregnant females, which you wouldn't do in internal medicine. Internal medicine also does a little bit more critical care in their training than family medicine tends to do.
Okay, wonderful. So I want us now that we've put that into perspective, let's talk a little bit about we're going to talk a little bit about pediatrics, children, because you do see quite a lot of them. Let's talk about some of the common complications you see in children. We take a couple of them and what is expected of the family medicine doctor when a child comes in. So a mother comes in, for example, with a child and says, look, doc, the child is crying, the child is, how you say, the child can't keep still and he's fussy, all of that, he's fretting and all of that. What is the first step? What do you do as a family medicine doctor?
So any patient I see, the first thing is sick versus not sick. So I'm trying to figure out, is this child needing to go to the hospital? Is it something that we can keep them at home? Do they look like they've been hydrated? If they're fussy and they're crying, are they actually making tears? So usually first step is sick versus not sick. Is this child safe to stay at home, or do I need to get this child into the hospital?
Right. And of course, what are the others? What signs you would look for then to determine the fussiness, the crying? Would you try to determine whether the child is having pain or whatever?
Definitely. So, with children, it can be difficult, especially depending on how young the child is. So, for example, I see children from birth. So in a 2-month-old, they're not going to tell me what's wrong. So we're looking for fever. I'm looking for signs of that they might be in pain. I'm examining, touching, seeing if they respond to touch, like they cry louder if I touch their bellies. Looking for diarrhea, any signs that maybe there's a disease process going on that I can potentially treat and help make the child feel better.
Okay, so you look after the child. What would you say to the parents? The child has to go back home, so it's not going to be at the hospital. What should the parent be doing to keep the child comfortable and, so that the child can, get over whatever the problem was?
So, that's a very wide question. It can depend on what the disease that I think is going on is. So we can take it, for example, one common thing, we'll take it by systems. So a common thing might be like a cold, so something respiratory. And if I'm thinking, the child might be having a cold, then I'm telling them, you go home, I'm giving you this medication. But if they're not breaking the fever, 3 days passes and they're still having a fever, that's concerning. You should call me. If the child stops eating and then they're not urinating, that's also something concerning. With respiratory stuff, so like colds, then it's always worrisome if the child looks like they're struggling to breathe. And the child, it can be hard to tell. So we describe it's sucking in air, using the belly muscles, using the neck, really struggling. All of those things need to be looked into further. The child isn't doing well.
Great.
Go ahead.
Yeah. Okay, I want to take it further from the common cold. What if you, based on what you're seeing in the child and the signs, symptoms, you feel that the child could be asthmatic? And we're talking about a young child here, a child, who can't say, well, look, doc, I'm having a headache or I'm having chest pains.
Yeah, asthma is very difficult to diagnose in a young child. It's easiest for me to make the diagnosis when they get to around 4 years old. Sometimes younger than that, it could be things like bronchiolitis. So bronchiolitis, it starts as a cold, but then it progresses, and you could get wheezing. So very similar to what you would see in an asthmatic. Often I find that children who tend to wheeze very young, they do grow to be asthmatics, but it's difficult to make the diagnosis in a younger child. Treatment is the same though. We try to give them the inhaler to open up the lungs. You can do that every 4 hours. If they're needing it sooner than every 4 hours, then that child is not safe to be at home anymore. They're needing medicine in too short of an intervals. And we try to just keep the child as comfortable as possible.
Okay. You mentioned bronchiolitis. There's also bronchitis. What's the difference here?
So bronchiolitis is going to be when your smaller airways. So the lung is like a tree, and it's like big to small, like little branches. So like from big branches to twigs. So bronchiolitis we often see in younger children, like 1 or 2 years old, and their smaller airways is where the disease tends to be, like mucus closing of the airways, whereas bronchitis is in bigger airways. So we see generally in older children, and the bigger airways are what's kind of closing.
Okay. In terms of severity, how would you rate the two, bronchitis, bronchiolitis?
Honestly, they both can progress and be very severe. They're very similar diseases. Children can get really, really sick and could end up in a lot of trouble from having either.
Okay, right. A very common one, even here in Grenada, it's very, very common, even in adults, but I want to touch, as it relates to children, stomach flu. That's what it's called? Gastroenteritis?
Gastro.
Yes. Let's talk a bit about that. It's a very common one, common condition in children. What brings it on?
A lot of gastro. Usually it's you ingest some sort of virus, it could be in water, food, it could be in someone else has it, they pass it on to you, but some virus starts, upsets the system and you see the body starts vomiting, diarrhea, trying to get rid of it. So the first thing is, we try our best not to stop the diarrhea because you want to get rid of whatever is in you making you sick. So like people will try taking like Imodium, trying to stop diarrhea, want it to pass through you. They'll help you get better faster. And then the second thing is with gastroenteritis, you really want to make sure your child is staying hydrated. And if you can do something with a little bit of electrolytes, not just pure water, that's also helpful. And there's Pedialyte that you can buy. You can also do things like mix a little apple juice with water for like a quicker sort of homemade electrolyte drink.
Right. There's another one that I personally experienced once in a child. I saw it. Seizures. Well, I don't know, but apparently, from what I understand, medicine can't seem to determine what brings it on. So a child just gets all stiff and and cries and anything in that area.
So it depends on the kind of seizures. Like there's epilepsy, but then in a young child in particular, what we see often is febrile seizures. So febrile seizures tend to be more common in kids under 2 years old. The good thing is that they're more scary to the parent than they're harmful to the child.
Okay.
They tend to not cause any lasting damage. Usually, if they're sick for any reason and the fever gets high enough, for some reason, the high temperature sets off a seizure. They don't last too long. They're usually under 15 or so minutes. And again, the child is usually fine after, but parents usually worry a lot. And I think the next thing I would say about that is that a seizure, a febrile seizure. So if the child had a seizure because of a fever, it usually does not mean that they'll grow up to have seizures.
Okay.
So they might not have lasting seizures. Of course, if your child has epilepsy, which could be genetic sometimes, that's a little bit more concerning and would need lifelong treatment.
Right. So prevention of some of these medical conditions in children, some of the common ones. What would you suggest as a family medicine doctor to keep your child safe from some of these conditions? Things like the common cold, I don't know how much you can do, but generally some of these conditions that can harm children, because at that age, the risk is greater, and so they need to be protected. What are the suggestions?
So the funny thing is we are seeing less common cold, and so this year, or end of last year, and it's because people are doing a lot of the things that help, which like washing hands, disinfecting surfaces, just simple things like that tend to be the most effective with all of these gastroenteritis, common cold, all of these things. Just keeping the virus burden down would help preventing them.
Okay, wonderful. All right, so I tell you what, let's take a short commercial break. When we come back, I want us to talk about some conditions in middle-aged people and elderly people. So stay with us. We'll be back with you in just a moment.
Now we can stay safe while at the same time reducing our budget to maintain a clean and safe environment at our home, school, office, church, or even on the bus. Fortune Foods has gone a long way to source premium products that are at least 30 to 50% less than other brands. That's right, 30 to 50% cheaper than other brands. We have a multi-purpose 80% strength liquid sanitizer for cleaning surfaces that is also safe on hands, as well as 70 to 75% gel sanitizers available in 1 gallon and smaller sizes. Plus, when you buy in bulk, you save even more. Right now, every dollar counts. Be wise. Sanitize with Fortune Foods' range of sanitizing products.
Distributed by Fortune Foods Company Limited, Tempe, St. George's. Telephone 435-2247.
How going on, boy?
Hey, good old things.
Hey, easy.
Yeah.
Boy, in line, boy. Your house looking a real good day.
Boy, it's thanks to the hard-working and professional staff at the Housing Authority of Grenada. They handled me real nice. They did my plan, they did the construction, and I didn't even have to worry about a thing. They were there with me every step of the way, supervising the job, asking me about my concerns, giving me feedback as the house took shape. They were there from start to finish, and even put the keys in the palm of my hand. I give them an A++ for customer service.
Oh, it's people from housing bad, boy.
Boy, not bad. Excellent. If you're thinking about constructing your home, why not consult the Housing Authority of Grenada? You could visit them right down in the Sandino complex, or give them a call, 440-1015 or 440-1016. Or check out their website, hag473.com. They go handle you. They go jog your blocks, they go draw your plan, they go tote your materials. Hey man, where you going? The Housing Authority of Grenada is your choice for affordable housing and a stress-free construction experience.
A message by the Grenada Distillers Limited.
You want a hand sanitizer to do 3 things: kill germs, be gentle, and to go where you go. You can get all of that in our hand sanitizer. Hard on germs, gentle on hands, affordable. Remember, hand sanitizers contain alcohol. Keep away from heat and flames and avoid contact with eyes. Available at retailers island-wide.
A message by the Grenada Distillers Limited.
Welcome back, everyone. With us, as I told you, just for those who joined us late, Dr. Nerissa Baptiste, family medicine physician, and she practices out of the U.S., and she's with us this evening. Doc, just before we move on to some of our elderly individuals, I want to just go back a bit. A couple of things I forgot to throw at you as it relates to children. Sore throat, air pain. Let's talk a little bit about that quickly.
So those are some really common ones that we get as well. Sore throats are usually a virus, and they can go away on their own. But one of the things that we have to worry about is something called strep throat. So that's actually a bacterial infection. For those, you really should see your doctor, because strep throat, if not treated with antibiotics, can have some long-lasting effects, and it can progress into a worse disease. You can see rash everywhere, and it's worse, even possibly a heart effects from it. So sore throat, yes, you can watch it, see how the child's doing, but usually if it's a virus, 10 days it should be gone. And if your child is continuing to say, hey, no, my throat is hurting, or if you were to look and it was really red and had a lot of like white stuff in there, that's a reason that you should have your child see a doctor.
Right. And you treat that with what? Antibiotics or? Yeah.
So strep throat would need antibiotics to be eradicated. Air pain, usually the question is it an air infection or not? And air pain is harder to tell if it's infected or not, and that's something you should see the doctor for, because that again could, use antibiotic air drops or oral antibiotics depending on how, terrible the infection is. Usually most heal pretty well, and the child will do well after treatment.
Okay, so that may not go on to create any problems with the child's hearing later on, or it can, if left untreated.
So the recent studies that I've seen has actually shown that we may overuse antibiotics in ear infections, and a lot of times they will go away on their own. But generally, practice-wise, we still tend to treat them.
Okay, all right, to be safe. Another very common thing you see in children is skin infection. They come with a lot of rash, gets red, and it can make them very uncomfortable. What causes some of these rashes, and how serious can they be for a child?
So generally, rashes with children fall into about 4 categories. So the first one could be a viral rash. So if they have a virus, the virus comes out on the skin in a rash. And a viral rash tends to be sort of everywhere on the body. Usually it's like really small, what we feel hits, a lot of little hits all over the place, yes. Then you might have a fungus, so like ringworm, if you remember, you see a little ring on the skin. And fungus usually wouldn't go away the way a viral rash would. For a fungal rash, you need to put a cream or something on there to have that go away. And those can be uncomfortable for children. They can get very itchy, and they can spread as well. The next category would be like a bacterial rash, and it's usually the most common one in children is called impetigo or impetigo, however you want to say it. I say impetigo. But impetigo tends to be on the face a lot. Usually there's a yellow crust to the rash. So you'll see the rash and then it'll be giving off a little fluid and it'll have some yellow crusting on it. That one needs to be treated as well because it can get pretty bad. It can keep spreading and it can become a very bad infection. Then the last thing you'd see with children, we call them contact rashes. So, for example, if your child was to have an allergy and, they touch something, then you'd see it comes up more like a a red sort of swollen area. We call it hives. And those are very uncomfortable as well. They could potentially go away on their own, but we can put a little cream on there to help the child feel a little bit better. Rashes it could be something not very concerning, and it could be something that's more serious. So seeing a doctor for a rash is always a good idea.
Okay, so that you can determine at least what is causing the rash. What about things like eczema and so? Do they affect children? Is one of the common conditions in children?
Definitely. So eczema is very, very common in children. The most common, there's different kinds of eczema. So the most common one that we see tends to be the one where you see this dry, thick skin around the elbows. Wherever the body flexes, you tend to see like dry skin. It can be very itchy for the child as well. And eczema, can leave scarring, again, uncomfortable. And that's something that putting a little bit of steroid cream on the child can help a lot. I always, educate my patients, though, on what causes eczema. So what causes it is that all of our skins have a layer of a fatty tissue on it that keeps the skin sort of sealed off and moisturized. And people with eczema, they lose some of that fatty layer. So the skin underneath gets dried out. And when it gets dry, it gets itchy, so it itches. And then you itch that dry skin, and then also trying to protect itself, the body makes that skin thicker, for protection. And then it's a cycle. So if you can try breaking that cycle by keeping the skin very moisturized, you can also help the symptoms a lot. So usually, some children with eczema, they need to be moisturized sometimes up to 8 times a day in really, really bad cases. And usually we say something heavy because, again, you're trying to replace that fatty layer on the skin and seal in the moisture.
Right. But if you lose that fatty layer, what are your chances of having this thing? Could it be lifelong with you, or can you gain back that fatty tissue too?
It depends. Some children, as they get older, they grow out of it. The skin heals and it gets better. Some people, they live with eczema for all of their lives.
All right. I mean, is it life-threatening? Can it be life-threatening? Can it, let's say, escalate to something else that can be life-threatening?
If we're thinking theoretically, if you were to have really bad eczema, as I was saying, it's itchy, so you scratch it. So you're having bad eczema, you're scratching it, you're breaking open the skin, you have open wounds now. Those get infected, the wounds aren't treated. Theoretically, yes, you can end up with a very, severe medical condition. You can get to the point that maybe the infection enters the bloodstream and you have a bloodstream infection. Deadly. So yes, it might seem very simple, but for some people, it potentially can get pretty life-threatening.
Okay, wonderful. So I want us now, Doc, to move to elderly folks and some of our senior citizens and some of the common conditions. And I wanted to start at least with the chronic conditions, especially the month of February being Cancer Awareness Month, and we would get to that briefly. But generally, as people get older, a number of things that's happening, because your body don't function the way it used to when you were a spring chicken, as we say. You lose some of your spunk, and you lose muscle mass. So let's talk about some of the common ones that you see on a regular basis.
So we're starting with comments. I think the most common complaint I get as people get older is knee pain. So I see a lot of arthritis. And it's hard, it's hard to avoid it. And then if you're moving on from there, then we start seeing things like hypertension, so high blood pressure, and diabetes, high blood sugar a lot. Which one would you like to start with?
Well, let's start with arthritis. What is it? What causes it? How do you deal with it? How do you help patients to be more comfortable when they have arthritis?
So as you get, so the most common arthritis, and the one I'm speaking about, is called osteoarthritis. There are different kinds of arthritis. So as you get older, your joints have a layer of cushion on them, on the bones, called cartilage. And as you get older and you're moving, we may have gotten a little heavier as we age, the cartilage tends to be damaged and the bone might be a little exposed. And as that bone rubs on bone, it causes a lot of inflammation and a lot of pain. The first line treatment for pain for arthritis is actually Tylenol. Feeling better with arthritis, one, I think it's the mindset. It's rare that we get people to be completely pain-free. You'll have some good days and some bad days, but staying active is usually one of the best things you can do. If you stay walking, keep the joints lubricated, keep your weight under good control, all of those things help with pain control.
But how do you, if you have arthritis, you're having pain, the cartilage has been worn, wouldn't it be difficult for you trying to exercise or maybe do a little brisk walking and stuff like that?
It can be painful, but usually sometimes the more you sit with it, the worse you feel. So I always say, if you're doing something and it causes you pain, stop. But gentle movement is usually good. So, if you're walking, maybe you won't be able to walk as fast as someone without arthritis could have walked. But a little walking is good. What tends to help is as you do activity, you're building the muscles in the legs. For example, if we're talking about arthritis in the knee, and if you build your muscles in the leg and they can help support some of your weight, then that takes a little bit of pressure off the joints.
Okay. I've heard people say that if you use things like chicken feet and gelatin, it can help replace cartilage. Is there any truth in this?
I haven't heard that one.
Yeah, I've heard this before.
I'm assuming it comes from people sell a lot of supplements like chondroitin. The thought process that if you give the body the materials that it needs to make the cartilage and make the fluid that lubricates the joints, somehow the body can repair itself. I don't believe there's been any studies that have shown that those things are effective, though. Typically, we don't see the body repairing much, and that's how you see people ending up with things like knee replacements, because eventually you have to surgically replace that pad.
Okay, all right, okay, great. So folks with arthritis, it might be helpful if you do a little exercise, a little walking, and so to keep your joints lubricated. That will help. You heard it from Dr. Baptiste. So let's move on to the next area. What was it? Was it hypertension you mentioned?
Yeah, so high blood pressure. High blood pressure, it's something a lot of people deal with. And what I always tell my patients is that sometimes maybe you come from a family that has high blood pressure and it's not something you did. So it could be, something that you inherited. Definitely lifestyle does help improve your symptoms. So if you're, again, exercise helps keep your blood pressure lower. Food as well. So high salt can cause your blood pressure to be higher. So eating well also helps. And then definitely, going to your doctor, keeping an eye on it, taking the medication that you're prescribed. Because if you leave your blood pressures to run very high for very long, high blood pressure can actually cause some damage to the body. It can cause kidney disease, heart disease, and even affect your vision and cause decreased visual acuity. So keeping high blood pressure well controlled is very, very, very important.
Right. Again, and I want to go back to the home remedies that we hear about, and we've heard people say that if you use things like the tamarind juice and you drink what bush and which bush and all of that, it can help lower your blood pressure. Now, there are a lot of people who they would not take the medication prescribed by the physician, but they would opt for the home remedies. So they go and they pull some bush here, they pull some bush there, they boil that, they drink it, and they think it's going to help. Maybe it does. I don't know. How much do you recommend that kind of behavior?
So this one's hard for me because I grew up like that. I grew up with my grandmother doing exactly that. I always say there's a balance. So the issue with home remedies, what makes it difficult is that you can't dose it, right? It's very difficult to know how much bush you need to drink. I do say be careful. Don't drink any and anything. There are plants out there that could be harmful, that could have toxins, could damage things like your kidneys. But what I would advocate for is if you're going to do something like that, you need to know if it's working. Mm-hmm. So you need to see your doctor and at least have your blood pressure get checked, get your blood work done. And if it's not working, then at some point, you might have to resort to the medicine. Because again, if this goes untreated, you can end up with a lot of, really bad health conditions. It could go beyond just having your blood pressure being high. So some sort of partnership needs to be done. Yes, you'll do a little bit of what you know, but you also have to partner with your healthcare professional, with your doctor. I know some people see the nurse as well, go to the clinics for blood pressure checks. You have to make sure someone's keeping an eye on you. Mm-hmm, mm-hmm, mm-hmm,
mm-hmm. What would you, in terms of the patient responsibility as it relates to hypertension, what would you say to them? And that's aside from, the balance with your medication and your bush.
So personally, I believe that we all need to be responsible for our healthcare. Doctors, nurses, they're there to advise you. They'll give you the best treatment to the best of their knowledge. But you do have to be responsible to follow the treatment, to take the medicine, to keep going, know your numbers. If you're not responsible and you don't care about your well-being, sometimes it makes it difficult for someone else to, do the thing that's best in your interest as well.
Right. Some patients, they go to the doctor, they get the medication, they start taking it, and after about a week or two, they feel better, and they stop.
Yeah, that's a common one. Oh, we see this all the time. It's a really, really, really hard one. A lot of education has to be done because, the medicine made you feel better. You stop taking the medicine, then you're going to be right back where you started. So that's why, keeping going, keeping your follow-ups is really important. Someone with a high blood pressure, for example, should not be seeing a doctor once a year. They should be going quite a couple times to, keep an eye on the numbers and everything like that. So I think another thing is talk to your doctor. Tell them, let them know. Because sometimes we think you're taking your medicine and you're not taking it. And we're adding a second medication. Oh, your blood pressure is always so high. We're adding another one. So
not knowing that you're not taking it.
Yeah, that happens all the time.
Right. Let's talk a little bit about some of the complications that can result from being hypertensive. Because being hypertensive can cause a number of things to happen to you. Let's talk about a couple of them that people should be aware of.
Yeah. So I'll start from head down. So in the head, vision. So high blood pressure can affect your vision. So if your eyesight is going, it might be that your blood pressures have been really high and uncontrolled. Coming down, you have your heart. It can cause heart disease and heart attacks. Mm-hmm. So, the way I explain this to my patients is, your blood vessels are a tube. So it's a tube, mm-hmm. And when your blood pressure is high, then the pressure inside that tube is higher. So the pressure rushing against the walls of the tube causes the walls to fray a little bit. when you have frayed tubes, it makes it easier for that plaque to stick on there. So cholesterol plaque is sticking. And when that happens and that tube gets blocked and blood flow can't go anymore, then that's a heart attack. And that's why having high blood pressures can cause so much heart problems, because it makes that tube so much sticky and makes plaque build easier. So heart problems can develop. Coming down in kidneys, it can damage your kidneys. And it is worse if your pressure is high for long enough. You may eventually need dialysis from kidney damage. So it can be very, 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 life altering, for lack of a better word. So those are like some of the most common ones that I really want people to be aware of. This is not something that's benign. For a long time, we called high blood pressure the silent killer. Yeah.
And it's very common, very, very common in Negroes. Is there something about ethnicity and hypertension?
Yeah, there is a thought that Black people tend to have higher blood pressures. It could be our genetics. There's a thought process if there's a difference with diet, if our diet may contribute as well. I lean towards, I think there might be some genetics involved.
Okay, wonderful indeed. We're going to be opening our telephone lines in a bit, but I want us to talk about another very, very common condition. In Grenada, it's very worrying because you're seeing a lot of young people coming down with that condition, diabetes. There was a time when you almost knew that someone who was diabetic was an older person. Now you're seeing teenagers who are diabetic. Let's talk about that, the dangers of this.
Yeah, I see a lot of diabetic patients. Diabetes is certainly on the rise. The current thought is that, we're seeing diabetes a lot in younger people because people are getting heavier. So with increased weight, it tends to be a risk factor for developing the disease. Diabetes, like hypertension, again, a lot of people ignore it. Even today, I was talking to one of my patients about it, very young girl, and she's like, oh, she feels okay. She doesn't want to take the medicine. But long-term, very similar complications. So it does increase your risk of heart problems. It can cause kidney problems. It can affect your vision. Something else that diabetes does, which tends to be the thing that my patients complain about the most, is it can affect your nerves. So it can affect the nerves in the feet especially, and cause the feet to be numb and tingly and painful. And that's something very difficult to treat and to live with. And then another thing we see is that you can see the diabetic ulcers forming on the feet, because it does affect your healing and how well wounds heal. And then at its worst, people have amputations because these wounds aren't healing on their feet. So diabetes can be something that is very, 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 very serious.
Let me ask this, and it's always, not bothered me, but I've always wondered about it. The fact that these ulcers don't heal, why not?
So there's a couple things with the sugars. The sugar tends to damage the blood flow to the area, so that sometimes part of the problem is the blood. The wound isn't getting a good blood supply with oxygen and nutrients to help them heal. And just that high sugar in the blood as well just sort of makes the cells just not come together very well.
Okay. So, but when you amputate, it does not remove the high sugar from the blood. So why would the amputation heal and the ulcer don't?
So as we were saying, that part of the problem is the blood supply. So as you go further down, so more distally towards the toes, then you see less and less and less. So you start seeing the nerve damage down there. You see, the less blood supply. So often, if you come higher, you're able to get a little bit better for blood supply and a better healing. So a lot of people do better. Worst case scenarios, I have seen people develop ulcers on the stump as well and have to get further amputations. So it is something that, if you're not taking care of it, it could be, you can lose a limb very easily.
Okay, very good. So we take our final commercial break. When we come back, we'll open the telephone lines and we'll take calls from our viewers and our listeners to hear what they have. So stay with us. We take our final break. We'll be right back.
Exploring the beaten trails, discovering uncharted terrain, connecting with people and places, giving a renewed appreciation for our flora and fauna. We are out and about, from the crystal white sands of Grandin's Beach to the cascading and majestic tumble of Concord Falls, the meandering of the St. John's River, or our undulating mountain ranges. We are out and about. Saturdays, live on GBN Television, our Facebook page, and our YouTube channel. Out and about, rediscovering the untamed beauty of Spice Country.
Long ago, the strength of Grenadians was in their arms as they worked the lands to get food for the table. Nowadays, most Grenadians' plate is packed with lots of starch and meat, little or no vegetables, plenty fried foods, and they wash that down with something sweet while sitting in front of screen. Hard work and exercise seem to be out of style, and lifestyle diseases are becoming the fashion of the day and claiming many lives. Let's make a change to live longer. Let us grow and enjoy a variety of natural and safe, fresh vegetables and fruits every day. Use our local fresh seasoning and spices to make our traditional dishes healthier and avoid highly processed foods, snacks, and drinks. Drink more water every day to help your body function better. Get moving every day and trade some screen time to share and enjoy healthy family meals. Choose healthy foods and healthy lifestyle. Follow the healthy choices for healthy living guidelines for Grenadians.
You've spoken. We have heard. Now we're making more time available for your evening primetime shows on K105. From Monday, July 6th, Your Law will air from 6 to 7 p.m. On Tuesdays, Simply Agriculture. And on Wednesdays, join discussions on constitution reform in partnership with Island Media. At 5:55 p.m., we bring you news headlines, a capsule on local, regional, and international events, followed by News at 7 via simulcast with GBN Television. Join Godfrey Augustine for stimulating discussions on Release It from 8 p.m. on Wednesdays and Thursdays. GBN's K105.5 and 105.9. We're with you everywhere and anywhere. If you're on the move, catch us online at www.gbn.gd.
My granddaughter.
Welcome back, folks. It's Doctor and Call, our live program, and Our telephone line is now open. The number is 435-2041. So if you have any questions you would like to ask Dr. Baptiste, you can do so now. The number again, 435-2041. All right. So we await your call, and of course, any contributions you would like to, you can do so. Doc, I want to come back to you while we wait on our callers. All right. And I wanted to go back to the arthritis that we spoke of earlier. There's a condition, and I correct me here if I'm wrong. I hope I'm not mixing up two different conditions as it relates to the bones, where sometimes the fingers can actually change shape. Is that because of arthritis, or am I mixing that up with a rheumatic condition?
So there's different rheumatic conditions. So what you're talking about sounds like rheumatoid arthritis. So rheumatoid arthritis is actually an autoimmune condition. So what that means is the body is actually attacking the joints. So this is not wear on the joints. It's the body attacking that joint. And then you can see the fingers can, get deformed. Can be very difficult to treat as well. Usually, for that condition, you need to have a doctor ordering medication to suppress your body's immune system so it can, decrease how much damage it's doing to your joints.
Okay. All right. So let's go to a telephone. We have a caller on the line. Dr. Nicole, good evening.
Yes, good evening to the doctor. I just want to find out, I had a family member who was recently diagnosed with gout. Could you tell me about the disease and if it's a form of arthritis or if it could be cured? Thank you.
Thank you, caller. Doc, you got the question?
Yeah, so
right.
Gout, I think, is the question. So gout is not arthritis. Gout is actually a deposit of crystals in the joint space called uric acid crystals. The most common place is the first toe, so your big toe. And gout, it can be prevented. So I'm not sure if cure is the best word, but you can give medicine to get rid of that current flare. And you can also give medicine to prevent future flares. So gout is very manageable.
Right. But you mentioned it can start with the big toe. Can it move to other parts of the body?
Yeah, I've seen gout in many different locations, and sometimes even in bigger joints, like in the knees. The common, again, in smaller joints like toes, but you can see it in many different joints. And then some people, certain things you do tend to make those crystals form. So it can be things like, eating a lot of red meat, drinking alcohol can also cause crystals to form. So people with gout need to be mindful of their diet, because that's also one of the ways you can control yourself from having future flares.
Okay, let's go back to a telephone. Dr. Nicole, good evening.
Yes, good afternoon, good night.
Yes, good evening, caller.
Yeah. I just want to ask the doctor, someone I know with an extended period of psoriasis, more than 2 decades. What advice can she give to that person in terms of what soaps to use and what diets the person can use to prevent or control the flares that take place with that disorder?
Okay, thank you very much, caller. Thanks a lot. Doc?
So that's a really good question. Psoriasis, is kind of like a cousin of eczema, which we were speaking about earlier. But psoriasis also falls on that autoimmune category, where sort of your body sort of attacking that area of the skin. Psoriasis can be very, very hard to control. Usually, you don't. And that might just be my area of expertise. I haven't seen a lot of great control with diets, like improvements with diets, and that just might just be something I'm not very aware of. usually I recommend my patients to use very gentle soaps. So you want to use, like Dove is a very common one, things that are not very harsh on the skin, because that can tend to make it more dry and make things worse. And then usually we use actually a lot of steroid cream, a very strong steroid cream to get the skin to calm down.
Okay, let's go back to our telephone. Dr. Nkong, good evening.
Hello, good evening.
Yes, good evening. Go ahead, please.
Godfrey, good evening. And Doc, good evening. How are you all doing?
Very good.
Very well, thank you. Good evening.
I called to say that I have diabetes, and I always have a pain in the heel of my foot. I don't know why.
Okay, thank you, caller. Doc, a pain in the heel.
So that, to be honest with you, it might not actually be your diabetes. It could be, it could not be. Usually diabetes pain in the feet, it tends to be more of a numbness and tingling. It's usually both feet. It's usually it's like a stocking distribution. It starts in the bottom of the foot and sort of moves upwards. It could be other things like heel spurs. It could be the condition called plantar fasciitis. So definitely something you might want to see your doctor about.
Okay, let's go back to our telephone. Dr. Nkong, good evening. Hello. Good evening, caller. Hello.
Yes, Doc, good afternoon.
Yes, go ahead, please, caller.
I just want to know. Good afternoon. Good night.
Yeah. Good night.
Caller, you need to listen to us on your telephone, yes? Listen to us on your telephone.
Okay.
Yes, go ahead, please.
Okay. Yes, I want to know what caused the itching of the underneath the feet. If you is a diabetic and under the feet are very itching.
Okay, thank you very much. Diabetic, having itching under the feet.
So again, it could be related to diabetes. It might not be. And again, seeing your doctor could be helpful. So the itching could be that tingling sensation I'm speaking about, that abnormal sensation. It's tingly, and that could be perceived as an itch. Also, we have to be aware that people with diabetes, because of that higher sugar in their blood, can be susceptible to fungal infections, and the feet is a common place to get a fungal infection. The medical term would be tinea pedis, and it could be that it's actually a fungal infection that can be treated with something as simple as an antifungal cream. So definitely having that foot examined could be very, very useful.
Okay.
So seeing your doctor would be great.
Wonderful. Okay, folks, the number 435-2041, just in case you missed it. Any questions you have, you can give us a call, and Doc will be more than happy to try and assist. Let's go back to a telephone. Dr. Nkong, good evening.
Good evening.
Good evening, caller. Go ahead, please.
Yes, I want to find out. People have this blood type, right? Which is O negative and O positive. But I'm confused that which one is the rare one. And yes, I would like to know that. Thank you. And is there another thing they could do, any other operation, no, not operation, sorry, any other thing they could do besides having the thyroid removed when they have enlarged thyroid gland?
Okay, thank you, caller. So, Doc, you have a double whammy. The blood type, O negative and O positive, and then an option as it relates to the removal of the thyroid gland.
So all blood types are good. The letters and the positive refers to two different parts of your blood. So the O, A, B, it's whatever you get from your parents, and then the positive that refers to an antigen that could be present or not, and it doesn't really matter. It just depends on what is compatible with the other. And then for thyroid disorders, so it depends on why the thyroid gland is enlarged. For some things like, goiters that can be caused by some of the diseases, there may be a couple more options than just doing surgery. There is something called radioablation. So pretty much you're sort of damaging the gland. So you're preventing it from making more hormone. There could be medicine to decrease the symptoms from that enlargement. So there could be a couple options, but it would depend on what the problem is. Because if your thyroid is enlarged because, for God forbid, there's a cancer there, you want to do that surgery and remove the cancer. So it really depends on the problem.
Right. But if you do that procedure that you mentioned earlier, and prevent the thyroid from producing the thyroxine, couldn't that be dangerous for you as an individual? Because the thyroxine does have its role.
Yeah, so often when we do that procedure and we do the radioablation, then we switch you into the opposite problem. So you might have an issue where the thyroid was producing too much hormone and getting too big, and we ablate your thyroid, and now you don't have enough. So then you end up on medications now replacing that thyroxine, which we prevented you from making naturally.
Okay. But in a case like that, I guess you would weigh the damage in terms of what would be more beneficial to the patient. So whether it's easier to probably give the patient the thyroxine as compared to allowing that gland to overproduce.
Yeah, it's always benefit versus risk in medicine. It's a lot easier to give thyroxine sometimes than control a thyroid that's just making way too much hormone. It's easier to replace the hormone at the right level after the fact.
Okay. You mentioned goiter. If it's a goiter, how do you deal with it? Is it same overproduction of thyroxine?
So it depends. Most of the time, what we call a goiter is like Graves' disease, and it is overproduction. Sometimes what some people refer to as goiters could be cysts or nodules, and those can be different things. Mm-hmm. So yes,
because generally, you see someone with let's say a swollen neck, and then you conclude it's goiter. It doesn't necessarily have to be that.
No, it doesn't have to be that.
Okay, wonderful. Okay, folks, 435-2041, that's the number you can call, and you can ask your questions or share your comments. Doc, before we started getting on telephone calls, we were talking about rheumatoid arthritis. We didn't get very far with it, and then the calls started coming. Let's just go back to that a bit.
So I don't know if there's another question with it, but it could be progressive. So your body's damaging joints. So, if it's left untreated, it'll get worse and worse and worse. And there are a lot of new treatments out with it as well. Like people are doing all these infusions, and so trying to get the body to stop attacking self.
Right, and you also mentioned autoimmune, and that one being one of them. Let's talk a little bit about that, because that's pretty common. Autoimmune diseases. What are they, and what do they do to a person?
So autoimmune conditions is a really, really, really big. There's a lot of them. Mm-hmm. So the definition of an autoimmune condition is auto. So your immune system attacking itself. So your immune system is supposed to fight off, things that invade the body. Mm-hmm. So if a virus comes in, it's supposed to fight it off. But now you're having the immune system fighting itself, and it can fight itself in a lot of different ways. So someone mentioned psoriasis, just spoke about arthritis. You can have things like lupus. You can have so many conditions with the body just attacking itself.
Right, but how do you treat it? How do you prevent that from happening?
So traditionally, the way that we treat it is we suppress the immune system, and steroids are first way to do that. There's other medicines like methotrexate, which you may have heard of. But at its basis, what you're trying to do is prevent the immune system from being so robust and attacking self. The downside to that is oftentimes when we're suppressing that immune system, now you're also susceptible to, if a virus, for example, was to come in, then you're a lot more susceptible to that.
That was my next question. But if your immune system is behaving bad and fighting the body, how would that affect, let's say, someone picking up a virus? Because your immune system, you mentioned robust, that means it's very active, and so aside from attacking the body, will it be able to also fight off foreign bodies like viruses, bacteria, and so during that period?
It depends on the kind of autoimmune condition you have. Most of the times it is able to. But sometimes I have seen in these patients that they do think that they're a little bit more susceptible to disease, because it's almost like the immune system is busy, so it's not tackling that thing as well as it would have if it wasn't doing more work trying to attack the body as well.
Okay, wonderful. Let's go back to our telephone. Doctor and call, good evening. Oh, so we lost that call. 435-2041, and that's the number you can call. And of course, you can ask your questions, whatever you would like to find out from the doctor. And remember, folks, we're giving you information, but it's also very important to see your family physician. If you feel unwell and you're not comfortable with something, it's always important to go and have yourself checked. That's the best way, because that way your physician will be able to better determine what might be the problem. All right, so we're giving you information, not trying to diagnose you via the program. We give you information to help you, so go see your physician so that you can get yourself checked out properly. All right. And Doc, we're getting close to wrapping up, so let's at least come to the big one. And we're getting close to the month of February, Cancer Awareness Month. So many different types of cancers, and two of the common ones, in women, the breast cancer; in men, prostate. Let's briefly just chat a little bit about that.
Yeah. So, I'll start with, you were just saying about going to see your doctor. And, growing up, something I realized that we didn't do a lot is go to the doctor just for a checkup. So we tend to go to the doctor when we have a problem.
Yeah, when you feel sick.
Yeah, think about breast cancer. Oh, it's the breast is so hard, it's hurting or something, and now you're going. Whereas, sometimes if we went in for a checkup, maybe your doctor would have noticed there was a small lump there and catch things early. So with cancer, our goal with cancer is always prevention, which is trying to catch it as early as possible. Because the earlier you catch it, the better chance you have of having a good outcome.
Yes, indeed. What are some of the causes? Because, breast cancer in women, it's something that we can never stop highlighting, because it is extremely common. How can women prevent that? What precautions can a woman take to limit the risk of, having breast cancer?
So that's a very difficult question, because oftentimes with breast cancer, it's genetic. So you're predisposed to having it. It's not necessarily something you did that brought it on. You're predisposed. So really and truly, it's catching it early, because the earlier you catch it, sometimes they may be able to just remove that little lump, and you might not even have to take out the entire breast. And that in itself is curative. I always tell my patients you should be breast aware. So often we don't teach the breast exams as much as we used to in the past, which I don't know if I agree with. I think, doing a breast exam is not necessarily a bad thing, but you should know if there's changes in your breast. And it may not just be a lump that you feel. It could be that there's drainage from the nipple. It could be that the skin is changing. We call it, it looks like an orange. So it has the pores look wider, bigger, looks rough. It could be maybe changed color a little bit, or it just feels a little bit harder. You should know if you're having changes in the breast, because the earlier you catch things, the better your chances of having a good outcome.
Okay, wonderful. And quickly, the prostate in men.
So very similar. Earlier, better. So with the prostate cancer, things that you want to look for at home is, are you having issues with urinating? And it could be, you go to urinate and you have to sort of wait and focus and force it out a little bit. It could be that, you're urinating, but it's dribbling, or your stream is starting and it's stopping. You're finished urinating, but it doesn't feel like you're completely empty. So early signs, and if anything that you can try, get to your doctor with and have them realize early that something's going on. Again, best chance of a good outcome.
Right, very good. Look, I want to thank you very much, but I wouldn't allow you to go if I didn't ask you about COVID in America. And I'm certain that you've seen, you may have, dealt with patients quite a bit. We know that we've been hearing talks, we follow the news, it's still bad, people are still dying, people are still getting infected. What's the situation like? Just give us an update.
So in my neck of the woods, it's actually very, very interesting. For the longest while, actually up until maybe last October, so March to October, my town only had 13 cases. We thought we were doing well. Like the rest of America seemed like it was dying, and we were doing pretty good. We were handling it. And all of a sudden, we just started to blow up. So it went from 13 to 500 to 1,000 plus. And there's so much people. Every single day I'm testing so many people. I'm getting so many back positive. My hospital is currently, out of beds. We're struggling that way. We're transferring patients out. Some people are getting very sick as well. The response is very different. People I thought will do so terribly with it are doing okay. Younger people that I think is going to do well and I don't have to worry about, they're calling me, they're not feeling good. So it's been quite a challenge. Every day we're learning more and more about the disease. The guidelines keep changing as to how we should manage the disease. So it's been very, 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 very difficult, and we're all looking forward to an end to this pandemic.
Right. But now that the vaccine is present, any changes? And are people responding well to the vaccine? Here in Grenada, we're hearing people saying, well, they don't trust, they're not going to take the vaccine. And in fact, last evening I heard some woman on the news saying that it's something to kill out black people, and I was appalled by some of these statements. But you hear them. But the vaccine is in the U.S. People are taking it. What's the response like? Are there any side effects? Are people responding well to it so far?
So far in my area, we've only had healthcare workers vaccinated, and most of us have done pretty well. The most common complaint I tend to hear is the area is sore, the arm is sore. There have been a couple people that the day after the vaccine, they've been very tired, had some sort of, flu-like symptoms. But overall, I haven't had, anybody hospitalized because they had the vaccine, or God forbid dead because they had the vaccine. We haven't had any really bad outcomes. The science is solid. And I think that hopefully the vaccine might be our answer to seeing a turn in the pandemic and some end to this misery.
Yeah, but in terms of people following regulations and protocols, how is that?
I think, and that's the problem in the U.S. It's so varied. You know, there are people who get it, and there are people that's doing everything they're supposed to do, and there are people who are just not listening, and they continue to do the same things, and they're outside without a mask, and they're not trying to social distance. And the funny thing is, when COVID comes knocking, then everyone's scared. Then they're calling and, oh my God, doctor, oh my God, I think I'm positive. I think I'm positive.
And the same one, these are the same ones who are not following the protocol.
Yeah, I think at some level everyone does respect COVID-19.
Right. Well, Doc, actually, I'm tempted to ask you about tomorrow, but that's for a different conversation. So I thank you so very much for accepting the invitation to appear on our program. As I told you earlier, it's your first, but definitely it won't be the last. With your extensive knowledge in medicine, I will be calling again to touch on different areas of medicine. So I want to thank you so very much for your time, and of course accept the invitation, and definitely I look forward to having you again.
Thank you so much. It was actually a lot of fun, and good night, Grenada, and good night, Godfrey, and maybe we'll see each other again in the future.
Very good. Thank you very much, and all the best. Have a good night. Yes?
Good night.
Yes. Okay, folks. So that was our program for this evening. Our guest, Dr. Nerissa Baptiste. And of course, as I told you earlier, she's Grenadian, earned her medical degree at St. George's University and completed internship and residency at Drexel University College of Medicine. And she's specialized in the area of family medicine, and she presently practices at Bradford Regional Medical Center in Pennsylvania. So that's our program for this evening. Of course, next Tuesday evening, yes, Doctor and Call again. As we get closer to the month of February, we will be talking quite a bit about cancer. February is Cancer Awareness Month, and we do have one of our doctors who is presently in Jamaica. We will have him on the program together with others as we discuss and disseminate information to you regarding this condition. So thank you once again. Don't forget, tomorrow evening, 8 o'clock, Release It. Do join me, and we have something big. Yeah, we have something big for you. So spread the word. Tomorrow evening, Release It. We have something big. Let people know. Join us at 8 o'clock. Thank you so much, and until tomorrow, please God, enjoy the rest of the evening.
COVID-19 is an infectious disease caused by a new coronavirus introduced to humans